We're going to sweep the room. All right. Hi, my name is Sitton Furman. I'm an NP student at Auburn University. Here is Maggie. She's going to be our patient today. And now I'm going to do my full head to toe assessment. So I have walked in the room. I've introduced myself. I've washed my hands, and I have closed the door for patient privacy. And to start, I'm just going to assess Maggie, her demeanor, just her general well-being. She has been talking to me. There's no stuttering or deformity to her speech. It's pretty clear and smooth. Can you tell me your name and date of birth?
Sure, Margaret Marie Embarrass, September 14th, 1996.
That is great. And where are we right now?
We are in my room in Nashville, Tennessee.
And who's the president?
President is Joe Biden.
And what year is it?
It is 20.
All right. She is alert and oriented ×3. And now I'm going to, I'm just assessing her skin throughout the whole assessment. Throughout this exam, I'm just going to do one side, but in a real exam, I do both sides. Her skin is clean. She is well groomed. To touch, it is warm. There's no diaphoresis or abnormal dryness or sweating. Throughout a real exam, we'd have her put on a robe so we'd see her skin fully, but for this exam, we're going to just keep wearing her clothes for modesty purposes. And we are going to start with the neuro exam. So I'm going to assess her short and long-term memory. Maggie, can you tell me what you had for dinner last night and breakfast this morning?
Sure. Last night I had a salad with chicken, and this morning I had a smoothie.
Good. And then for her long-term memory, can you tell me where you grew up?
I grew up in Greenville, South Carolina.
Great. And I'm going to tell you 2 words, and I'm going to ask you in a little bit what those words are. Okay. Flower and ball. Cool. All right. And now I'm going to assess her neuro. For part of this, I'm going to ask her to stand up and walk. And so can you just walk down that line for me?
Sure.
Just a normal gait. And that is normal. And then I'm going to have you walk heel to toe, just to right here. All right, that is great. And then can you walk on your toes back towards the end of the rug? And then on your heels back towards me. All right, that is great. And then I'm going to assess her Romberg. And so I'm just going to have her close her eyes. And I'm going to stand behind her to make sure she doesn't fall. And her balance is great. Now I'm going to have her sit back down. I'm going to assess for graphesthesia and stereogenesis. So can you close your eyes for me? And I'm going to put something in your hand. And can you tell me what it is?
A pen.
All right, that's stereogenesis. And then I'm going to close your eyes for me. I'm going to write something in your hand. You'll tell me what it is. Great. That is great. And now I'm going to assess her perception to touch. And I'm going to do this with something soft and something sharp. And so can you close your eyes for me and tell me where it is and if it's soft or sharp?
It's soft on my cheek.
Yes.
Sharp on my wrist. Sharp on my thigh. Soft on my ankle.
All right, that is great. And now I'm going to assess her reflexes. First, I'm going to do the biceps reflex. And so we are looking for, you can do this with your finger down or without your finger down. We should see a little movement here. I'm going to do the triceps, so I'm going to try to have her relax and look this way to try to get her to not pay attention too much. And so we're going to do it right up here, and we're looking for a little movement right here. And then I'm going to do the brachioradialis reflex right here. And we're looking for a little twitch in her thumb. And now I'm going to do her patellar reflex. So we're going to have her lean over, speed up a little bit. There we go, so if you can see it. There we go a little bit. And we do all of this bilaterally, but for this exam, we're just going to do it unilaterally. And then we do the Achilles reflex. So we look for a little movement in the toes. All right. Now I'm going to start her HE&T assessment. Well, actually, first, what were those 2 words?
Flower and ball.
There we go. Now I'm going to do the HE&T assessment. First, I'm going to inspect her hair. There's no abnormal patches or nits or anything. No alopecia. Is there any tenderness when I palpate? Yeah. Now I'm going to palpate the frontal sinuses, the maxillary sinuses. I'm going to percuss. Any tenderness here? No. All right, I'm going to assess facial nerve 7 or cranial nerve 7, the facial nerve. Can you puff out your cheeks for me? Smile, frown, and then squint your eyes. And try to open them. Don't let me open them. All right, that is intact. I'm going to assess cranial nerve 5. So can you clench your jaw for me? And then I'm palpating the masseter muscles. And then can you open and close? And also assessing her temporomandibular joint. And it is intact. Any tenderness when I palpate? Okay, I'm going to assess her eyes. I'm looking at the eyebrows, eyelashes. There's no abnormal deformities or any swelling in there. I'm assessing her or inspecting her iris, her cornea, conjunctiva. There's no erythema or abnormal redness in there. I'm going to then auscultate, or not auscultate, but keep inspecting. I'm going to inspect inside her eye for the fovea centralis, the macula, the optic nerve, the retina, and any blood vessels in there. There's no abnormal redness in there. I'm going to assess her optic nerve, which is cranial nerve 2. You can close one eye and then hold this in front of you and read the lowest line that you can.
LTFPH.
All right. And she has 20/20 vision. We do it on both sides, but for this exam, we're just going to do it on one side. I'm also going to assess for confrontation. And so can you close your eye? And then tell me when you see my fingers coming.
See it. See it. See it.
Okay. And that is cranial nerve 2 as well. I'm going to assess for the red light reflex. And I'm also assessing for constriction and dilation of the eyes and that they're consensual. Her eyes are equal, round, reactive to a light and accommodation. I'm also going to assess cranial nerve 3, 4, and 6. The oculomotor is 3, trochlear is 4, and abducens is 6. And so can you keep your head straight and then follow my finger? All right, and those are all intact. I'm also going to assess now I'm going to go on to the ears. And so first I'm just inspecting. There's no abnormal lesions or any changes in her skin color, tone. It's warm. I'm going to palpate. Any tenderness here? No. No tenderness. And I'm going to inspect inside her ear. All right, and for an adult, I'm going to pull up, out, and I'm inspecting inside for the tympanic membrane. It is pearly gray, as it should be. The cone of light is at 5 o'clock, and I see the bony labyrinth, or not the bony labyrinth, the malleus at 5 o'clock. I'm going to assess cranial nerve 8, the acoustic nerve. And so I'm going to get behind her and ask her if she can tell me what she hears from a whisper.
My name is Maggie.
And I do it on both sides, but for this exam, I'm just doing it on one side. I also inspected the internal canal and the external canal when I was doing the ear exam. Now I'm going to do the nasal exam. And so I'm going to first inspect. There's no abnormal lesions. I'm going to palpate. Any tenderness here? No. No tenderness. And then can you breathe for me? And then breathe. And I'm inspecting the nares for patency. Now I'm going to inspect inside. And I'm inspecting the septum, nasal turbinates, any abnormal mucus, and there is none. I'm going to assess cranial nerve 1. And can you close your eyes for me? And tell me what you smell. Thanks. Yes. All right. and that is the olfactory nerve. And back to the ear assessment, I'm going to do the Weber and Renee test. I'm going to strike the tuning fork for the Weber test and place it on top of her head, and she's going to tell me if she feels it and hears it in both ears. All right, and for the Renee test, I'm going to strike, place it behind her ear, and when she doesn't hear it anymore, I'm going to put it in front, and that's testing for air conduction. Air conduction should be greater than bone conduction. All right, and that is great. That's within normal limits. Now I'm going to assess her mouth. First, I'm inspecting her lips, and can you smile for me? Her dentition, her gums, and open your mouth. Her uvula, her hard and soft palate, her tonsils. I'm going to look inside her mouth. Open for me. Say alrighty. Everything looks great. There's no erythema or swelling in there, or any abnormal lesions or cuts. Her uvula moved up, and that's cranial moved up when she said and that's cranial nerve 9, the hypoglossal nerve. For cranial nerve 10, the vagus nerve, you can use the gag reflex, but for this video, we're not going to gag our patient. And then for your tongue, can you move it left to side, left, right, and left? There we go. And that's cranial nerve 12, the glossopharyngeal nerve. Everything is intact. All right, and then cranial nerve 11 is the spinal accessory nerve. I'm going to have her shrug her shoulders and then push against my hand and then push this way. It is all intact. I'm going to assess her trachea. It is midline. There's no deviations either way. I'm going to assess her thyroid, and so I get behind her and displace her trachea and ask her to swallow, and then do the other way. And her thyroid is symmetrical on both sides, which is within normal limits. I'm going to palpate her lymph nodes, do the preauricular, postauricular, carotid, retropharyngeal, submaxillary, submental, anterior cervical, posterior cervical, occipital, and then the supraclavicular. And is there any tenderness there? No. And I don't feel any abnormal nodes. Now I'm going to go on to the respiratory assessment. First, I'm just inspecting. I'm inspecting for symmetrical expansion as she breathes. Can you take a deep breath for me? That is equal expansion. And I'm assessing her anterior posterior diameter, and it's 2 to 1 as it should be. I'm going to come behind her and assess for tactile firmness, and can you say 99?
99, 99, 99.
All right, and it is, I could feel her tactile firmness. It's not abnormal. I'm also gonna assess for expansion from posterior. Can you take a deep breath for me? And I feel equal expansion. Now I'm going to auscultate anteriorly and posteriorly. Deep breath for me. And I don't hear any gurgling or crackles or anything like that. It's very clear. I'm going to do it posteriorly as well. All right, and I'm also going to percuss. And I don't feel any dullness or hyperresonance that could be fluid buildup or COPD or emphysema. And whenever I percuss on the front side, I would not want to do it over the rib. I'd want to do it in the intercostal space as to get the correct sound. And so I have listened to her lungs. Now I'm going to do the cardiac exam. First, I'm inspecting. I don't see any abnormal pulsations. I will do all of her pulses in the palpation stage. But for her JVD, I'm also going to inspect when she's laying down at 45 degrees. But I don't see any abnormal pulsations. Her skin is still intact. I'm going to palpate her carotid artery. And I do this on both sides, but for this exam, I'm just doing it on one side, her carotid artery, her brachial artery, radial pulse, I would do her femoral pulse, but for the exam, I'm just going to state it. Do her popliteal pulse. Her dorsalis pedis pulse. And posterior tibialis under her sock. And they are all 2+. And I would do this on both sides. Now I'm going to auscultate her heart. And when I was palpating, I didn't feel any thrills or any abnormal pulsations. Everything was equal. And now I'm going to auscultate her heart. I'm going to auscultate with the bell and the diaphragm to get different high and low pitches. First, I will start with her carotid. You can take a deep breath in for me. And I did not hear any bruise. I would do this with the bell and the diaphragm. And now I'm going to auscultate the areas of her heart. This is the aortic, right sternal border, second intercostal space. Pulmonic, left sternal border, second intercostal space. Erb's point, left sternal border, third intercostal space. Tricuspid, left sternal border, fourth intercostal space. And mitral, mid clavicular line, fifth intercostal space. Now I'll do it with the bell. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And now I will have her lay down on her pillows. And so this is 45 degrees. I'm assessing her JVD. I don't see any abnormal pulsations, no abnormal distension. And if there was, we would measure it, and that would be something to note on the chart. Now I'm also going to auscultate her heart laying down with the bell and the diaphragm. Aortic, pulmonic, Erb's point, tricuspid, mitral. And I would also do this with the bell. One thing that I forgot to mention while she was sitting up was to palpate the point of maximal impulse. So I do that while she's sitting up, and I can also do it while she's laying down, which is right at that mitral line, the mid-clavicular line, fifth intercostal space. And there's no abnormal pulsations or thrills. Now I'm going to auscultate and palpate the abdominal aorta. Sometimes you can palpate it, sometimes you cannot. And it is normal. I'm going to auscultate. No abnormal bruise. I'm going to auscultate the iliac artery and the femoral artery. And I would do this using the bell and the diaphragm, and I do not hear any abnormalities. Also in the cardiac, I'm going to assess for any edema in her legs. There's no edema or swelling. Can you feel me touching you down here? Mm-hmm. No peripheral neuropathy. I'm also going to assess for capillary refill. And if their fingers are painted, you can do the tip of their nail or their finger. And it's less than 2 seconds, so she has great perfusion. And I'll do this on both sides and in upper extremities and lower extremities. I also don't see any visible veins, so her perfusion in her legs are great. Now I'm going to do the abdominal exam. I'm going to inspect first. For modesty purposes, we're going to keep her clothes on. I see symmetry. There's no abnormal lesions, no pulsations, or anything like that. So after the inspection, which is different with the abdominal exam, I'm going to auscultate next, and then percuss and palpate. I'm going to auscultate with the bell and the diaphragm. Auscultating with the bell and the diaphragm and the bell in all 4 quadrants. I hear active bowel sounds. And again, to say again that I would do this normally from stethoscope directly onto the skin. So then I'm going to percuss in all 4 quadrants. All right, and that is normal. I'm also going to percuss for the liver diameter. And I'm going to percuss on the right side up until I hear dullness and mark it here. And I'm going to percuss down from the ribs and in between the ribs and the intercostal spaces. And I would measure this. And for women, it should be 7, men, it should be 10. I'm now going to palpate. First light palpation and then deep palpation. And I'm going to ask the patient first if there's any painful area, and I would do this last. Do you have any painful area in your abdomen? No. All right, first I'm going to do light palpation. Any tenderness? No. And then I'm going to do deep palpation. Any tenderness here? No. All right, and then I'm going to palpate for the liver. So I'm going to feel it here, and I feel it is normal. I'm going to feel for bilateral kidneys. So I'm going to put my hand underneath and push up here. Kidneys are not abnormally large, and there's no tenderness, is there? Any tenderness in your kidneys? Nope. And then you should not be able to palpate the spleen. And if this is, it would be an abnormal finding, maybe some inflammation of the spleen. Now I'm also going to palpate the inguinal nodes and I don't feel any abnormalities. All right, I'm going to have you sit up real quick. And I'm going to percuss for CVA tenderness, and you want to make sure your patient is sitting down while they're doing this. So because it can be very painful, and you want to make sure they don't fall down or anything. So I'm going to get behind her. And actually, let's go on that side real quick. All righty, and I'm going to percuss or pepper right here, right where the kidneys would be. And is there any tenderness there? Nope. All right, that is great. And we'll come back around. Thank you. Okay, now I'm going to do the musculoskeletal exam. I'm going to first assess, and throughout this whole exam, I've been assessing the skin. There's no abnormalities, no lesions. I'm assessing the muscles for atrophy. I don't see any atrophy here. Throughout the exam, we're going to test for strength, for range of motion, for symmetry in both sides. First, I'm going to inspect the shoulder and palpate the shoulder for any tenderness. Is there any tenderness here? Nope. All right, I don't feel any abnormalities. And the elbows, tenderness, nope. And all the way down to the wrists. I don't feel any abnormal crunching or any crepitus or anything like that. And I'll do this bilaterally, but for this exam, I'm just going to do one side. I will start with the upper extremities. And so now I'm going to test for range of motion. Can you lift your arm up and then push it back behind you and bend your arm? All right, and that's flexion and extension. And then can you lift it up in front of you like this? And then rotate out and rotate in. And that's internal and external rotation. And then can you hold your arm out or in front of you for your elbow? Can you supinate, pronate, and then bend and bend out? That's flexion and extension. And then for your wrists, can you invert them, evert, and then up, down, and then fan out your fingers and flip them. There we go. And that is for range of motion. And now I'm going to test for strength. And so can you try to bring your arm out? All right. And then put your arm out and push down and then push up. All right. And then for your hands, can you put your hands out like this and then push down? Push up with your wrist. All right. And then don't let me open your hands. All right. And now we're going to assess the hips, knees, and ankles and toes. So you can lay down for me. All right, first I'm inspecting. Everything seems symmetrical. I'm going to palpate. Any abnormalities and tenderness here? No. All right, I'm going to palpate down to her knees, the patella, making sure the patella can move. It should be able to move. No tenderness here? No. All right, and I'm palpating all the way down to her ankles. I don't feel any tenderness or any abnormal heat. All the way down to her feet. Any tenderness there? No. No tenderness. Can you flex your leg up and then down? All right, and then can you bring your knee up? And then I'm going to externally rotate and then internally rotate. There we go. And then you can put your leg down. Also, one thing that was just passive range of motion, but you would make sure your patient always has active range of motion. And when she brought her knee out, that was abduction, and when she brought her knee in, that is adduction of her hip. And so then we saw flexion and extension of her knee. Now I'm going to go down to her ankle. And can you put your toes towards you? And that's dorsiflexion, and then point them out. And that's plantar flexion. And then can you flex your toes and then bring them in? There we go. And then can you point your toe toward the midline and then pull it away? There we go. That's inversion and eversion of the ankle. And now I'm going to test for strength. Can you try to bring your leg up? All right, and then try to bring your leg down. There we go. And then push against my hand. And then push forward like you're pressing on the pedal. There we go. And that is for range of motion and strength of the musculoskeletal system. And have you stand up one more time. And then, yeah, over there. All right, and then can you lean side to side? And this is assessing her spine. And then go forward for me, flexion, and then extend backwards. Alrighty, and then I'm gonna turn you around real quick. And I'm looking at her spine. Her curvature, it seems normal and straight. There's no sign of scoliosis. I'm also going to palpate down her back for any tenderness, or I'm not using any tenderness there. Nope, no tenderness. All right, and then one last thing, I'm gonna have you sit back down. And then for your neuro exam, can you bring your heel up to your shin and rub it down, up and down your shin? And then go back up. Yeah, like this. Oh. There we go. And we do that bilaterally, and that is a normal finding. And I'm also going to have you check for fine motor movements, and so go back and forth. There we go. And then touch your nose, and then put your nose to my finger, and then go back and forth. Your finger to my finger, not your nose. Oh, no, you're right. Oh, yeah, you're right. Do it fast. All right, and that is intact, and that is the completion of our head to toe assessment.